5 major nerves. Okay? Let us learn all the 5 major nerves one by one, guys. Now, to begin our class today, this was the revision of the previous class, and now to begin our class today, guys, the first topic that we are going to begin right now will be the common peroneal nerves. First, let us begin with the common peroneal nerve. Guys, remember, common peroneal nerve, it is also known as the common fibular nerve. Okay? I told already in the beginning, nothing to show you. Now the first nerve that we are going to learn, common peroneal nerve. And common peroneal nerve, it is also known as common fibular nerve. Common peroneal nerve is also known as common fibular nerve. If you people stop commenting, I think you can concentrate on the class. You can concentrate on learning part. Common peroneal nerve, it is also known as the common fibular nerve. Common peroneal is also known as common fibular nerve. Fine. Now, I hope you remember our upper limb topic. In our upper limb topic, already I told you, any nerve, whenever you're going to learn first of all the origin of the nerve, guys. First, origin. And now, origin is already damn easy for us. Division of L4 to S2. Common peroneal nerve is going to originate from the posterior division of L4 to S2. Okay. Common peroneal nerve is going to originate from the posterior division of L4 to S2. And apart from that, on the other day, I already told you, common peroneal nerve is a part of your sciatic nerve. You remember sciatic nerve? I already told you the concept of sciatic nerve also. Sciatic nerve is made up of two nerves. One is your common peroneal nerve plus tibial nerve. You know? Sciatic nerve is made up of two nerves, common peroneal nerve plus tibial nerve. Fine. Prajwal, your doubt is why not till S3? It's not in your hand, it's not in my hand. It is there in our body like that, and we are learning like that. It's common sense. It's up to S2. They have found in the research. And apart from that, if you want to find that, you can do the dissection of the cadaver. Okay. Next one. So origin, I'm done with origin. Okay. The posterior division of L4 to S2 and sciatic nerve component. It is a component of sciatic nerve. After writing the origin, the next thing that we need to write down here is that supply. Common peroneal nerve will be supplying to which muscles? Now guys, we all know that the common peroneal nerve will be dividing into two branches. One will be the deep peroneal nerve, another one is the superficial peroneal nerve. One is deep peroneal nerve, another one is the superficial peroneal nerve. And not only that, we even know the compartment also. Deep peroneal nerve is supplying to all muscles in the anterior compartment of leg. And the superficial peroneal nerve will be supplying to all the muscles in lateral compartment of leg. So the anterior compartment of the leg and then the lateral compartment of the leg. So till here already we know very well. And now the only thing that we need to learn is about the muscles right now, guys. So let us learn about the muscles. And first we are going to learn about superficial peroneal nerve. See, superficial peroneal nerve will be supplying to all the muscles present in the lateral compartment of the leg. What are the muscles? Only two muscles, guys. Only and only two muscles. If you are observing, all the points on the screen properly, each and every point you very well know. You already know about the origin, you already know about sciatic nerve, you already know about division, everything you know. You already know compartment also. The only new thing that we are learning today, yes, in the lateral compartment, two muscles. One will be the peroneus longus. Another one will be the peroneus brevis. So one will be peroneus longus, another one is peroneus brevis. These are the only two muscles in the lateral compartment of the leg. Now, if you want to see this lateral compartment of the leg, you can see this picture here, guys. This is the lateral compartment of leg, and in this I'm able to clearly see here, this is one muscle, peroneus longus, and this is another muscle, peroneus brevis. Now guys, don't get confused with the another name of that one. I told you already, peroneus, the name can be replaced by fibularis, but please don't remember this name of fibularis. Oh, why? Because in all your exams, everywhere the word that is used is peroneus longus and peroneus brevis only. So just remember that name only. And that completes the lateral compartment of leg. Ho gaya. Done. So there are only two muscles. Now welcome to the anterior compartment of the leg, sir. All the muscles in anterior compartment of the leg will be supplied by deep peroneal nerve. In this, there will be one peroneus muscle. Here, if you observe the trick here, already two peroneus muscles are done. This is the third one, that is by peroneus tertius. This muscle name doctors have given as peroneus tertius. And please concentrate, where are we right now, guys? We are in the leg region. Can you people tell me, in the leg region, which two bones do you have, guys? What are the two bones in leg region? What are the two bones in leg region? Yes, very good. We'll be having tibia and fibula. And it is so easy because we are in the anterior compartment. Come on, apply the common sense. Because we are in the anterior compartment, that is why the name of the muscle will be tibialis anterior. So there will be one peroneus muscle, and that will be the third peroneus muscle, peroneus tertius. And because we are actually in front of the tibia, that is why tibialis anterior. And apart from that, in the anterior compartment, you'll be having extensor muscle. There will be extensor hallucis longus. Another one will be extensor digitorum longus. These will be two more muscles in the anterior compartment. Now guys, it is so easy to understand. Look at the word hallucis. Hallucis means what? Great toe. You remember, like in the upper limb, our hand, thumb will be actually known as pollicis. Some will be pollicis. Whereas in the lower limb, the great toe will be hallucis. So one muscle is for great toe. And not only great toe, what about the remaining toes? The remaining toes will be supplied by digitorum, extensor digitorum longus. And these are all the muscles in the anterior compartment of the leg, sir. That is all about deep peroneal nerve. And if you want to see this one, just observe this diagram here. In this diagram, you are able to see here, one is peroneus tertius. There is a small muscle, peroneus tertius. And in front of tibia, this muscle is tibialis anterior. Then you'll be having one for digitorum, another is for hallucis. So extensor digitorum longus and extensor hallucis longus. So these are all the muscles in the anterior compartment of the leg. And by this we are done with like two compartments, guys. One is the lateral compartment, another one is the anterior compartment. Lateral compartment, another one is the anterior compartment. Done. Clear? Now whatever muscles that you are able to see here, guys, these are actually only the motor supply. Now let us see about the sensory supply. Okay, what about the deep peroneal nerve and what about the superficial peroneal nerve? Let's see sensory supply. So I remove that. Deep peroneal nerve and superficial peroneal nerve. Deep peroneal nerve will be supplied to the skin in cleft of first and second toe, whereas superficial peroneal nerve will be supplied to the skin of dorsum of foot. That's all. Okay, so that is about the sensory supply. You people first write down, I'll tell you the meaning of that one, guys. Okay, so a skin in the cleft of first toe and second toe will be supplied by deep peroneal nerve, and whereas the skin of dorsum of the foot will be supplied by the superficial peroneal nerve. Skin of the dorsum of the foot is supplied by superficial peroneal nerve. Done. Now to understand this more clearly, please look at this diagram here right now. In this diagram, this will be the first toe here and this will be the second toe here, sir. And between the first toe and second toe, only this much skin here, sir. Between the first toe and second toe, only this much skin here. Only that skin in the cleft of first toe and second toe, that will be supplied by which peroneal nerve, sir? Deep peroneal nerve. And the remaining dorsum of the foot will be supplied by superficial peroneal nerve, sir. Okay. So this is what you have to remember about the peroneal nerve. Done. Sir. हो गया. So by this we are done with the common peroneal nerve, and then we are done with the deep peroneal nerve and the superficial peroneal nerve, sir. So that completes our first important topic. Done. हो गया, sir. And don't worry about the diagrams, and also all the diagrams you'll be getting it the moment the class is done. I'll forward you all the topics, all the diagrams I'll forward you. Okay, all the images I'll forward you guys. Now once this is done, guys, let us go to the next topic right now. The next topic that we are going to learn is the applied aspect of this one, guys. Clinical correlation. Clinical correlation. In this diagram you are able to see the foot drop. The foot drop. And remember, foot drop is due to injury to which nerve? It is injury to the common peroneal nerve, sir. Okay, apply your common sense. Common peroneal nerve, if it is injured, what is going to happen, sir? Both the nerves are gone. Even deep peroneal nerve is gone. Even superficial peroneal nerve is gone. Deep peroneal nerve is supplying to which muscles? Anterior compartment of leg. In the anterior compartment of the leg, which muscles do you have, guys? You will be having what muscles? Extensors. Come on. So that means what is going to happen? If common peroneal nerve is gone, deep peroneal nerve is also gone, anterior compartment muscle is gone, then extensor is gone. If you are unable to extend the foot, अगर आप foot को extend नहीं कर पाओगे, if you are unable to extend the foot will be drop. So this condition is actually foot drop condition, and in foot drop condition they'll ask you the nerve involved. The nerve involved will be common peroneal nerve. The nerve involved in the foot drop condition will be common peroneal nerve. Chalo. This completes one of the important topic. Now let us go to the next topic right now. Please write on the heading there as the tibial nerve, guys. And here I want you all to fully pay attention, guys. Why? Because this is the biggest one. Why I'm telling you the biggest one nerve here right now, guys? Why? Because you also know very well that tibial nerve is going to supply to all posterior compartment of thigh, posterior compartment of leg, and then the muscles of foot also. So it will be like, you know, a big topic. So I want you all to have some patience and let us keep on learning. और अगर ये वाला nerve अगर हो गया तो remaining will be quite easy for us. In any nerve, first of all we need to write down origin, and in origin my students are like expert. Tell me what is the origin of tibial nerve? Anterior division of L4 to S3. Anterior division of L4 to S3. The next is, we already know tibial nerve is also a component of which nerve only? Sciatic nerve. Sciatic nerve is made up of what? Common peroneal nerve plus tibial nerve. Common peroneal nerve already done, and now we are going to learn what, guys? We are going to learn about tibial nerve right now. And now welcome to the real thing, that is supply. It supplies to which muscles? All posterior compartment. तो चलिए सर one by one पढ़ते हैं. First of all, the posterior compartment of thigh. First of all, let us learn the muscles in the posterior compartment of thigh. Now guys, in the posterior compartment of thigh, I hope all of you know that we'll be having which muscles? Hamstrings. In common English, we'll call them as, you know, hamstrings. And in the hamstring muscle, चलिए आज सीखते हैं what are the names of hamstring muscle. There will be one muscle which will be semitendinosus, and another muscle which is semimembranosus, and another muscle that will be biceps, but this time it will be biceps femoris. So semitendinosus muscle, semimembranosus muscle, and biceps femoris muscle, these three muscles actually collectively are known as the hamstring muscles. So hamstring muscles will be semitendinosus, semimembranosus, and biceps femoris. Once you are done with the writing work, please look at the diagram. Let us learn more perfectly. So in this, you can clearly see that this one is semitendinosus here, and this one is semimembranosus here. Okay, I remove this. This muscle here will be semitendinosus, and this muscle behind that will be semimembranosus. So semitendinosus will be overlapping semimembranosus. And on the other side, you are able to see this muscle here, and this will be biceps femoris. My dear friends, tell me what is the meaning of biceps? Biceps का मतलब क्या होता है? Bi means two, and the word ceps means what, sir? Heads. There will be two heads. So there will be long head, there will be short head. So this muscle which is coming from here, this will be long head of biceps, and this small muscle behind here, this will be short head of biceps, guys. Is it okay? So there are two heads in bicep femoris. Obviously, there'll be long head and short head. कितना आसान है, हो गया. So these are the hamstring muscle. Semitendinosus, semimenosus, bicep femoris, long head, short head. चलो. And now, if you are comfortable with the notes and if you are comfortable with the picture, and now welcome sir, I'll tell you exception. और जहाँ जहाँ exception, वहाँ वहाँ question. तो ध्यान से सुनिए. Bicep femoris will be actually having like two heads. There'll be one long head and there will be short head. Okay. By the way, let me see how much you're understanding in my class, guys. All these muscles will be supplied by which nerve? All these muscles that we have written here, they'll be supplied by which nerve? Very good. Obviously, we are learning which topic is tibial nerve. They'll be supplied by tibial nerve. Lovely, lovely, lovely. Welcome to the exception. In bicep femoris, out of this long head and the short head, only long head will be supplied by tibial nerve. Only long head is supplied by tibial nerve. Remember the exception. Short head will be supplied by common peroneal nerve. Why? Because if tibial nerve is not supplying, the only option available is common peroneal nerve. That is one of the very important thing for your MC exams. Has been asked many times. So one important MCQ done. Remember, long head of bicep femoris is supplied by tibial nerve and the short head of bicep femoris will be supplied by common peroneal nerve. Now if you are done with one exception, chalo, let me teach you one more exception here, sir. One more question possible. Yeah, you people now did not see this diagram. Yes, of course. Yes, if you observe this diagram, आपने अगर ना ध्यान से देखा होगा इस डायग्राम में, हमने ना शॉर्ट हेड कंप्लीट किया, लॉन्ग हेड कंप्लीट किया, सेमी टेंडिनोसिस कंप्लीट किया, सेमी मेम्ब्रेनस कंप्लीट किया, everything done. And now the one more muscle is left out here right now, guys. And this muscle will be, you know, अब इसका ध्यान से सुनना, इसका कहानी क्या है, थोड़ा सा ध्यान से सुनना. Actually, that muscle name is adductor magnus. The moment I see this word adductor, guys, adductor मतलब कहाँ पर होना चाहिए पता है आपको? In the medial compartment of thigh. Which compartment? Medial. On this medial side, it should be on the medial side. Why? Because that is helping in what? Adduction, bringing the thigh closer, adduction. तो adductor magnus कहाँ पर होना चाहिए? Medial compartment. और फिर ना मेरा वाला रूल अप्लाई कीजिए. If it is in the medial compartment, it should be supplied by which nerve? अगर medial compartment में होगा तो which nerve should supply to that one? Obturator nerve, है ना? Obturator nerve should be supplying to that one. हाँ, लेकिन पंगा is that it is present in medial compartment, not only in the medial compartment. From the medial compartment, that muscle is actually extending to the posterior compartment also. Okay, and that is the reason why doctors have divided that into two parts. The part which is extending behind, the part of the muscles जो पीछे आ रहा है, इस muscle को क्या कहा जाता है? Hamstring part. Hamstring part of adductor magnus. Understanding? So the part which is going to take a turn and come back, and that part is actually known as the hamstring part. Okay, so only that hamstring part will be supplied by which nerve? That will be supplied by your tibial nerve, because it can be clearly seen in this picture that this part is actually coming in the posterior compartment, and my students are expert posterior compartment. All the ones are supplied by which nerve only, guys? Tibial nerve. So adductor magnus, only the hamstring part will be supplied by tibial nerve. Sure. So please include this one also here. Adductor magnus. And in the bracket you write down only which part is supplied, guys? Only the hamstring part. Only which part, guys? Hamstring part. Perfectly done, sir. And that completes, you know, all the muscles in the posterior compartment of thigh. Posterior compartment thigh done. And all of them are supplied by which nerve only? Tibial nerve. And exceptions I told you. Short head of bicep femoris is supplied by common peroneal nerve. And adductor magnus, hamstring part. Actually confusion is adductor. It should be in the medial compartment. लेकिन उसका एक छोटा सा part पीछे वाले compartment में भी आता है. So therefore it will be supplied by which nerve only, sir? Tibial nerve. Okay. So that completes your posterior compartment of thigh. Now you all know which topic are we learning? We are learning tibial nerve, and tibial nerve is supplying to not only thigh, it will be going down and supplying to leg region also. Which compartments are? Posterior compartment. So please write on the heading there as the posterior. Okay, next side heading. Continue the notes. Posterior compartment of leg. In the posterior compartment of the leg, you'll be having calf muscles. And in the calf muscle, I don't know why, every student knows these two muscles perfectly, guys. Which two muscles? You are able to see these two muscles here. Gastrocnemius. There'll be one medial head and there'll be a lateral head. Medial head and lateral head of gastrocnemius. अगर आप इस मसल को कट करोगे, कट करके अगर आप नीचे देखोगे, if you cut this muscle and see below that muscle, you'll be able to find soleus. If you are unable to understand in this diagram, please look at this diagram here right now. In this diagram, you are able to see gastrocnemius, and below this gastrocnemius, there is one more muscle here, that is soleus, guys. ठीक है? तो चलिए लिखिए sir. Now in this diagram, we have seen the two muscles. Write down the two muscles there first of all. Lateral head and medial head. Of which muscle? Of gastrocnemius. Okay, and after that, below the gastrocnemius, you're able to find one more muscle, that is the soleus muscle. So first you're having gastrocnemius and then we'll be having soleus. iPhone X, I told you I'm not visible today. Wantedly I have kept it close. Why? Because it is lower limb topic, nothing to show here. Okay, so just observe on the screen. So there are two muscles here right now, guys, gastrocnemius and soleus. अब हम क्या करेंगे ना, इस गैस्ट्रोनेमियस को भी रिमूव करेंगे और सोलियस को भी रिमूव करेंगे. इफ यू रिमूव द गैस्ट्रोनेमियस एंड इफ यू रिमूव द सोलियस मसल कंप्लीटली, देन व्हाट विल हैपन? Then once you remove these two muscles, then below in the deeper layer you'll be able to find some more muscle, and that muscle in the deeper layer, we can compare the name with the anterior compartment. In anterior compartment, just now we wrote tibialis anterior. Here there will be tibialis posterior. In the anterior compartment, just now we wrote extensors, now here will be flexor. So there will be flexor hallucis longus. Another one will be the flexor digitorum longus. चलिए सर, अगर आपको देखना है तो let me remove this muscles here, gastrocnemius and soleus, and then show you this muscle here right now, sir. Tibialis posterior, and then below that there will be flexor digitorum longus, and then there will be flexor hallucis longus. So tibialis posterior, flexor digitorum longus, and flexor hallucis longus. And apart from that, you are able to see one small muscle here, popliteus muscle, and then one more muscle in the posterior compartment in this diagram, along with the lateral head of gastrocnemius. You can see plantaris. There is a muscle here, that is a plantaris muscle. So please include these two muscles also in the list. So it's a very long list of muscle. One will be your popliteus muscle, another one will be the plantaris muscle. Popliteus muscle and the plantaris muscle, guys. So in the posterior compartment of the leg, you'll be having gastrocnemius and soleus. Then you'll be having these three muscles we have to learn together, and then remember the two small muscle. One will be the popliteus muscle, another one is the plantaris muscle. Are you comfortable with this one here? Are you all comfortable with this one here? Guys, out of all these muscles, which muscle is known as the peripheral heart? Peripheral heart. Peripheral heart. Yes, remember this question has been asked many times. Soleus. Soleus is known as the peripheral heart of the body. Soleus is known as the peripheral heart of the body, guys. The reason is very simple. Whenever we are sitting at one place for long duration, okay now, like so many people nowadays are leading very sedentary life. Only they'll be remaining at one place, for hours together they'll be sitting at one place only. So because of that, what will happen? Due to gravity, the blood will pool down. I hope you know the condition of varicose veins. The veins will get dilated, and the condition is so bad, the lower limb has to be amputated. It has to be cut. So that's the reason why always we advise the people to just don't sit at one place for long duration. You have to just get up from your place and start a little bit walk for 5-10 minutes, and then again come back and sit. So the reason being varicose vein. And who is going to help in that one? Your soleus muscle is going to help in that one. When you walk, this soleus muscle is actually contracting, and when it is contracting and relaxing, आप जब walking करते हो ना, तो ये muscle contract और relax होता है. जब वो muscle contract और relax होता है, the blood which is getting pulled down in the lower limb will be sent back into circulation. That is why this is said to be the peripheral heart of the body, and that question has been asked many times in our exams. And now we'll come to the last and final thing here right now, guys. We are done with the posterior compartment of thigh. We are done with the posterior compartment of leg. And finally, now welcome to the foot. Muscles of foot. The good news here, you don't have to learn the muscles of foot, guys. Muscles of foot पढ़ने का ज़रूरत नहीं है for the MCA exam. They will never ever ask you that one. Then what do you have to learn in the muscles of the foot right now? Only remember, all the muscles will be supplied by two nerves. One will be the lateral plantar nerve. Another one will be the medial plantar nerve, sir. And on the other day, last class, I told you already, okay, these two nerves are the branches of, come on, answer me. Very good, very good, very good. These two nerves are actually the branches of your tibial nerve only. So tibial nerve will be coming in the foot and it will be dividing into two branches, medial plantar, lateral plantar. And remember, these two nerves will be supplying to all the muscles of foot, sir. And that completes the tibial nerve supplied to the muscles. Tibial nerve supplied to the muscles. Okay. Now, welcome to the skin wala part, sir. Tibial nerve is supplying to which skin? So, for skin wala part, you already know we need to write on the heading there as the sensory supply. I told you in the beginning of the topic, this topic will be a little bit lengthy topic, guys, so have some patience. I'm done with the motor supply and now welcome to the sensory supply. In sensory supply, remember, tibial nerve is going to give rise to a branch and that will be known as the sural nerve. Sural nerve will be actually supplied to the skin on lateral side of leg and foot. Sural nerve will be supplied to the skin on the lateral side of the leg and the foot side. The skin on the lateral side of the leg and the foot will be supplied by which nerve? Sural nerve. The skin on the lateral side of the leg will be supplied by, and foot will be supplied by sural nerve. And once you are done with the writing work, welcome here. Now I'll make you understand what is the meaning of that. मान लो कि यहाँ पर you have your leg and मान लो कि this is your foot here right now. And the lateral side of the leg skin and the lateral side of the foot skin will be supplied by sural nerve. And remember, sural nerve is a branch of which one, guys? It is a branch of your tibial nerve. Sir. So tibial nerve will give a branch, sural nerve. Sural nerve is supplying to lateral side of the leg and the foot. And not only that, the tibial nerve is going to enter into the foot. And after entering into the foot, the tibial nerve is dividing into two branches. One will be the lateral plantar nerve and another one is the medial plantar nerve. What do you want me to repeat, sir? Sural and how to understand that? Look at this diagram. In this diagram, this is leg here and this one is the foot here. And on the lateral side of the leg and the skin on the lateral side of the foot will be supplied by sural nerve. And sural nerve is a branch of which one, guys? Tibial. So lateral side of the leg and the foot is supplied by sural nerve. And sural nerve is a branch of which one, guys? Tibial. Okay, done. Then welcome here right now. The tibial nerve is going to take a turn and enter here and supply to the plantar surface. In the hand, it will be palmar and in the foot, it will be plantar. And on the plantar surface, yes, look at the way how symmetrical it is. It is absolutely same. In the plantar surface, lateral 1.5 digit. Lateral 1.5 digit is supplied by lateral plantar and medial 3.5 digit. 1, 2, 3, 3.5 digit will be supplied by medial plantar. I hope you remember our upper limb topic. In our upper limb topic, already exactly the same, hai na? Exactly the same. In the upper limb topic also in the palm, it is 1.5 and 3.5. So here also it is the same, sir, 1.5 and 3.5. Okay. So that is also taken care by which nerve only? Lateral plantar, medial plantar. These two are the branches of which nerve only? Tibial nerve. Last thing to write here, sir. Likho. Isko likho aur khatam karo, sir. So the second one that we are going to write down there is plantar surface. ठीक है? Okay. और विल जस्ट ड्रॉ अ सिंपल डायग्राम हियर राइट नाउ सर. ऐसे काम करो. Write it like a U here right now, U, and then what you do is इसको टोज लगा. क्या बात है. ये वाला